Good morning. My name is Genevieve Thomas, and I'm a lactation consultant with UCLA Health. And in today's live webinar, we're going to be talking about supporting breastfeeding mothers. And I'm here with Shadman Habibi, who's going to introduce herself.
Hello, everyone. I'm Shadman Habibi, lead certified nurse midwife with the UCLA Midwifery Associates.
And this week we're celebrating World Breastfeeding Week. It's every year from August 1st through 7th. So we ask you to join us with your questions today. So if you have questions about breastfeeding or how UCLA Health supports moms to breastfeed, please ask your questions on Twitter using the hashtag UCLAMDChat, or you can also comment on Facebook. So we look forward to hearing from you as we go through it today. So this is just a little bit about World Breastfeeding Week that I can share with you. And we do have some notes today that I'm going to be referencing just to make sure we cover everything. So World Breastfeeding Week is celebrated every year from August 1st through 7th, and it happens all over the globe. It's a super exciting time for us to be able to encourage and improve the health of mothers and babies by supporting breastfeeding. So it was started by the World Alliance for Breastfeeding Action, or it's also called WABA, and it's a global network of individuals and organizations that are really committed to the protection, promotion, and the support of breastfeeding worldwide. And it's really focused on the work of the World Health Organization, UNICEF's global strategy for infant and young child feeding. So the theme this year is Breastfeeding, Foundation of Life, because breastfeeding is a universal solution that really levels the playing field. It gives everyone a fair start in life. And today we're going to talk a little bit about breastfeeding. We're going to hear about our UCLA Health baby-friendly designated hospitals, which is kind of exciting. And we're going to hear about our midwifery practice. Shadman's going to share about that. And we're going to learn a little more about how we support mothers to breastfeed both at home and at work. So now we're going to hear a little bit from Shadman.
All major healthcare organizations, including American Academy of Pediatrics, American College of Obstetricians and Gynecologists, and American College of Nurse Midwives, recommend exclusive breastfeeding for the first 6 months of life with gradual introduction of complementary foods at that time. Most organizations recommend that babies continue to be breastfed through the first year of life, and many families will find that breastfeeding beyond a year is beneficial for both mother and baby.
That's good. So we have a little quote here. Let me just get it up for you. There you go.
Breastfeeding is a natural safety net against the worst effects of poverty. If the child survives the first month of life, the most dangerous period of childhood, then for the next 4 months or so, exclusive breastfeeding goes a long way toward canceling out the health difference between being born into poverty and being born into affluence. It is almost as if breastfeeding takes the infant out of poverty for the first few months in order to give the child a fairer start in life and compensate for the injustice of the world into which it was born.
Wow, that's a really profound statement. We know also that breastfeeding is also cost effective. So this graphic actually comes from the World Bank's new investment framework for nutrition. So the World Bank cares about breastfeeding, which I think is kind of noteworthy, right? Yeah, kind of noteworthy. In their framework, they note that if we could meet the World Health Assembly's target for exclusive breastfeeding in the first 6 months, we could save 520,000 children's lives over the next 10 years. And in addition, if the World Health Assembly targets were to be reached by 2025, we could save almost $300 billion in additional economic gains across lower and middle income countries. And we could also generate these results as based on cognitive development. That's how important breastfeeding is, as well as child survival rates. So this analysis found that for every $1 that we could invest in helping a mother to breastfeed, it actually generates $35 in economic returns. And that isn't just a global perspective, it's a local perspective as well. This is true in LA County. We know that the costs of low rates of exclusive breastfeeding are really high. So if 90% of Los Angeles families were to be able to breastfeed for the first 6 months, as recommended, and that's exclusive breastfeeding for 6 months, the savings to the Los Angeles economy would amount to $1.1 billion. That's billion with a B, not million, billion with a B per year. But we know our mothers need our help, and that's why we really focus on how we can support moms, because almost half of all exclusive breastfeeding mothers had started supplementing by the 3rd day of life. So you want to tell us a little bit about UCLA Health's commitment?
At UCLA Health is committed to these global and local strategies by offering multimodal care for birthing families, including having a robust midwifery practice by adopting the 10 steps to successful breastfeeding and becoming baby-friendly designated hospitals by providing internationally board-certified lactation consultants, both inpatient and outpatient, as well as having a state-of-the-art lactation accommodation policy for our employees. We will share a little bit more about each of these items. The first and most important way we can support families to prepare for breastfeeding is by supporting them in having well-defined goals.
So well-defined goals are really important, beginning right away with knowing what you want. So the U.S. Surgeon General actually issued a call to action in 2011 to support breastfeeding. And in that call to action, she has this quote, which really underscores the importance of these well-defined goals. It says, in the immediate postpartum period, such as in the hospital right after childbirth, the marketing of infant formula can really detour exclusive breastfeeding, and it may have an even stronger effect among women who do not have well-defined goals for breastfeeding. So we know that the role of the providers to help families to have those well-defined goals for breastfeeding requires that our providers show unfettered support for breastfeeding, because breastfeeding can be hard. We need tangible solutions for when breastfeeding isn't going well. And breastfeeding isn't always easy at the beginning. If we judged breastfeeding by the first few days, a lot of people would be discouraged. So we know that it requires talking to families about breastfeeding at several times during their prenatal visits in hospital and during postpartum care. Would you like to share more on that?
This is also part of UCLA Health's commitment to offering evidence-based practices. The U.S. Preventative Task Force states in their Agency for Healthcare Research and Quality report that interventions that took place over a combination of time periods are more effective in promoting, protecting, and supporting families to breastfeed. At UCLA, we use a variety of ways to support the family's decision to breastfeed their babies.
So when we know that breastfeeding is the most successful when the patients have a real plan, a plan to breastfeed, right? And they are given all of the information they need to support their plan to breastfeed. And they have a circle of support, not just provider support, but also support in the home as well. So the way that UCLA Health supports this model is that our providers support our patients with a real commitment to breastfeeding support from the very first prenatal visit. And in a moment, Shadman's going to share more about that. And then information is provided at all of our prenatal visits. But in addition, we have birthplace classes that are available, breastfeeding support classes. We also have childbirth prep and baby care and CPR classes so that parents feel confident when they leave the hospital that they can care for their baby and feed their baby. And then in addition, we have an environment where breastfeeding can blossom. Our baby-friendly designated hospitals have all adopted the 10 steps. I'll show more about that in a moment. We also provide inpatient lactation consultants so that moms are seen in the hospital by a lactation consultant, as well as a new pilot outpatient lactation program, which I'm excited to share, as well as mother-infant support groups for all of our patients who deliver at our hospital, because we know after they leave, they may have more questions. And oftentimes when mothers support each other, they feel like they can reach their breastfeeding goals. So these are our midwives. Go ahead and tell us a little bit about them.
Here's a group picture of our current nurse midwives in our practice. From this side, this is Ayali Sacker, Erin Datura, Elizabeth Keat, that's me, Shadman Habibi, and Miriam Mivakar. These are the 5 full-time nurse midwives. the UCLA Health Midwifery practice promotes breastfeeding right from the first visit by giving information on how to have a successful breastfeeding relationship. We start by talking about the benefits of breastfeeding. We do a complete physical exam to make sure everything looks normal and answer any questions you have. The services, and we talk about the services that are available at UCLA Health, including breastfeeding classes. We talk about resources in the community, which may be closer to your home, because we know that our clients that come to UCLA and seek midwifery care come from all over LA metro area. We also talk about having family and friends to support you at time of discharge from hospital after giving birth. We know that women and families are successful with breastfeeding when they have adequate emotional and physical support at home for what can often be a challenging endeavor. Yeah. The midwifery group at UCLA attempts to help women create that support from the very first visit with us.
Yeah. So this is a little bit about how to reach the midwives. And so do you want to share a little bit more about
yes.
our practice here?
So you can always call and come and start seeing the nurse midwife group at UCLA right from the first visit, right from when you know you're pregnant, you can come and see us. Our outpatient clinic is located in Santa Monica, 1223 16th Street, Suite 3100 in Santa Monica. The office, our clinic, is located right across from Santa Monica Hospital, which is also on 16th Street, 1250 16th Street in Santa Monica. You can always reach the midwives if you have any questions for us on our information line. The information line is 310-794-4434. You can leave your questions on that message number, and we will return your call on the same day. We also have Meet the Midwives on the first and third Thursday of each month at 1:15. You can RSVP by calling the UCLA OBGYN appointment center number, and that is 310-794-7274. At that Meet the Midwives, we give a short presentation about our services, what we do, who we are, what we do, what our expertise is, and you also have time to ask questions. It is a really good time to discover if midwifery care is right for you.
And if you're thinking about having a baby anytime soon, this is a great opportunity for you to come and meet our midwives. So I'm going to tell you a little bit about our baby-friendly designated hospitals. So both Ronald Reagan Hospital as well as Santa Monica have been designated as baby-friendly. And this is another way that UCLA Health is really committed to supporting breastfeeding, especially through our policies and through our practices. When we achieved the World Health Organization UNICEF baby-friendly hospital designation, it really shows that we've taken all of the extra steps to make sure that the environment that moms give birth to their babies in is going to help breastfeeding flourish. So Santa Monica was just designated this last April, and we're thrilled to announce that we got our designation rather rapidly, so we were very, very excited about that. In addition to being baby-friendly designated hospitals, our two hospitals are routinely ranked among the top 2 hospitals in LA County for exclusive inpatient breastfeeding rates, which means that we're doing the right thing in our hospitals. With Ronald Reagan being the #1 hospital in the County of Los Angeles for more than 5 years in a row. So we're very proud of that achievement. The Baby Friendly Hospital Initiative is a global program to encourage a broad-scale implementation of these 10 steps to successful breastfeeding. And this is a research and evidence-based set of recommendations that hospitals and healthcare providers and the community can implement to make sure that moms get off to the best start. It requires that we comply with the International Code of Marketing of Breast Milk Substitutes, which means that we don't promote formula. We make sure that moms who want to breastfeed are given all of the help that they need. So hospitals that are designated as baby-friendly, we give mothers the information and the confidence and the skills necessary to really successfully initiate and continue breastfeeding their babies, or to also safely feed with formula when that's required, because sometimes that is required. So the 10 steps to successful breastfeeding really require our hospitals to go through a rigorous process of auditing, and I can attest to that because I've helped with that auditing of our policies and practices to really ensure evidence-based support for breastfeeding. And we have implemented these 10 steps. And we are continually engaging in quality improvement work so that we can make sure that we're improving our practices. And that's part of UCLA Health's commitment to supporting breastfeeding. Oh, and this is outpatient. This is exciting. Do you want to talk about the picture first?
Yes.
Yeah, go right ahead.
This is Coralie, one of our midwife clients. I was at her birth, and this is Coralie breastfeeding her little one at home, and she agreed to share this beautiful photo during this webinar. She had an unmedicated birth. This was her first baby, and she labored for a long time. She actually also pushed for a long time, but had a beautiful birth, healthy baby, and she has been successfully breastfeeding. I thank her for allowing us to share this beautiful photo.
Yeah, so we know that with breastfeeding, it doesn't end when we discharge our patients. It's very important that we have outpatient support. So we've launched a new pilot outpatient lactation clinic, and we also plan to expand that clinic over the next year. Right now, we just have a few contracts. But we also have a system of support after discharge that includes providing over-the-phone triage support for our breastfeeding families. It includes using an automated telephone system for follow-up care. And so if a mother's having any breastfeeding problems, she can push a number and that message will be routed to one of our lactation consultants, and we'll call that mother and make sure she's getting the help that she needs, referrals out into the community to support her. We also offer 2 mother-infant support groups, as well as screen most of our patients, actually all of our patients, both inpatient and on the outpatient, for postpartum depression, because that is something that we really care about, is making sure our moms who are at risk are screened, and then there's no wrong door. We want them to know that whenever they come in, that we can direct them to resources. So when breastfeeding isn't going well, we really want to investigate why, right? We really want to make sure that the family is receiving a multidisciplinary approach to sorting why the mother-baby diet is not really adequately feeding their baby for optimal growth. You know, the baby expects to be breastfed when they come out, and while lactation and breastfeeding is the natural conclusion to the reproductive cycle, sometimes it doesn't go as easily. So when it isn't going well, it could be an indication that there are other health stuff going on. So we want to make sure that we assess appropriately, refer back to our providers, and really support those mothers to be able to get all of the care that they need to make sure that breastfeeding goes really, really well. Oh, and we also support our employed mothers. Do you want to share a little bit about that?
The University of California has a state-of-art lactation accommodation policy which applies to all 10 campuses and the Office of President and Lawrence Hall of Science. UCLA has an excellent procedure for accommodating employees as well as designated space. This is a map
right here
of some of the locations that are available on the Westwood campus. There's also a location at the UCLA Medical Center at Santa Monica. But as the policy states, supervisors can provide other space to support employed mothers to breastfeed.
And this is one of the more common questions that moms will bring up for us, which is, I have to go back to work. Should I even start breastfeeding if I'm going to have to go back to work? But the law actually supports, in California, actually all over the United States, a woman's right to be able to continue to breastfeed. So both federal and California law provides legal protection. And actually in California, we have the strongest legal protection for breastfeeding women across all of the 50 states. So we actually have a law that supports a mom's right to breastfeed in public. So wherever she's publicly allowed to be, a grocery store, at the Hollywood Bowl, on the UCLA campus, wherever she is, she can breastfeed her baby. We also have jury duty exemption for moms who are in the primary care of their infants. Sometimes employed mothers who get time off don't always get jury duty exemption, but all of our moms who are in the primary care of their infants do. We also have workplace accommodations that require the space and time for a mom to be able to pump. And this is regardless of immigration status. And this is really important because it doesn't matter if you're a visiting adjunct professor who's here from another country or whatever your status is, you have that right to time and space. And then we also have a really important law that says that lactation is an other related medical condition to pregnancy. And so therefore breastfeeding is protected for discrimination. So we can't discriminate for employment or housing. So that's one of just a little cross-section of the laws. There's also a law that protects students and a couple of other really important laws. So if anytime you're thinking about going back to work and that you want to pump, you have the right to be able to pump breast milk for your babies. And so that brings us a little bit to the end of what we're doing right now. At UCLA Health to support breastfeeding and celebrate World Breastfeeding Week, we have several events coming up. We have a baby wearing demonstration that'll be at Ronald Reagan Hospital in the cafeteria on Monday. And I hear we have some questions. We have some questions? Excellent. So let's hear from what some of the questions are.
I will read the questions. Do smaller breasts produce less milk?
Oh, do you want me to take that
yes,
one? Okay.
Please take that one.
So breast size has no impact on a woman's ability to make milk. In fact, I've seen women with really tiny breasts, almost flat, make hundreds of ounces of milk and they're just fine. And I've seen women with really large breasts who sometimes have problems making milk. So breast size has nothing to do with your ability to make milk. Having adequate tissue is important, but just by looking at breasts, you have to get really in there and what do you have to offer on that as well?
Yes, when we do the physical exam, when you come and see us and that first visit, we do a physical exam and we do breast exam, and women do ask that same question. And we reassure them that they are made to breastfeed, that milk will come in, and they will have enough help and support to initiate breastfeeding as soon as baby is born. And a lot of our clients do ask us, what will happen? Will I have baby right away? And of course, yes, baby comes right after birth, comes up to your chest. And I have seen that babies automatically start crawling towards the nipple right after birth. Sometimes it takes a few minutes, sometimes it takes half an hour, but sometimes those first few minutes and you see your baby crawling towards your breast to start breastfeeding. It is amazing, and again, the size of your breast does not make a difference.
Sometimes women will notice that their areola and their nipples darken. It gets a little darker, and it's kind of cool, the reasoning why, but it helps the babies find the breast. So it helps them target it when they're doing that crawl. So if you are pregnant and you've noticed that you're having some breast changes, that would be normal, and we would expect that to happen. That means your placenta is telling your body, get the milk factory ready. Another question?
Next question. Why do some women produce less milk than others?
Well, that's a complex question. Do you want me to take that one?
Sure, you can start.
Okay, I'll start. So when a woman is healthy and she has a healthy pregnancy, her milk will come in generally around day 3, around 72 hours after she delivers her placenta. And for the first couple of days, she has milk. In fact, women have milk from about 16 weeks of their pregnancy. So right away, the placenta tells the body, get the milk factory ready. So you're making milk before you even have your baby. And some women even experience leaking of colostrum before their babies are born. So that colostrum, that early milk, is milk. It is still milk. It's just low volumes of milk. And that's normal. And we would expect that to be that way for the first couple of days. But then we expect the big production to take place. So the more a woman breastfeeds from the time the baby is born until about 72 hours, the more she breastfeeds, at least 8 times in 24 hours, or the way I say it is 8 or more in 24. You got to do 8 or more in 24, especially on the first 48 hours. Then the more milk you make over time. Moms who have a rough start at the beginning, moms who have C-sections, who are a little bit older, who have some other kind of complex health histories, sometimes those mothers experience a delay in their milk coming in. And the more delayed the milk is in coming in, the harder it is to bring in. And then sometimes they experience low milk supply. So the key to avoiding low milk supply is to get off to the right start.
Right.
Breastfeed in the first 2 hours, breastfeed 8 times or more every day. And if you can't breastfeed, if the baby refuses to latch, because sometimes we have those babies, hand expression.
Right.
We teach moms hand expression in the hospital, learn it prenatally, or pump. And those are ways that we can reduce the risk of having low milk supply. Some women have health conditions like hypothyroidism, gestational diabetes. Some of those times help to help. They hurt milk supply. So we have to do some extra things to help those moms. Mm-hmm. So there are a lot of strategies. If you are concerned, we ask you to reach out to your midwife, your OB, or come and call a lactation consultant. You can call us at 424-259-8248. And a lactation consultant can answer your question or talk to your midwife, because there are things we can make sure that we help you with in that immediate postpartum period to make sure that you have all of the milk that you need. Yeah. Do you have more to add?
And the emotional and physical support that you have at home also makes a difference sometimes makes a difference in your milk supply. Having enough people around you at home to support you, to help you rest, to help you take naps, to feed you, to make sure you're well hydrated. And also that emotional support that says, no, you're doing fine. Your baby is doing well. Let's try it again. Yeah. And having people, family and partner and family around you that feel comfortable if there are difficulties in breastfeeding those first few days at home. So having that supportive environment around a breastfeeding woman is also very important. So that if it is difficult the first few days that you're home, you still have the support to keep trying and having the supportive pediatrician, supportive lactation consultants, and family around you do make a difference in eventually producing enough milk.
Well, and I want to just underscore what you said, Shadman. The provider and the partner and the mother's mother statistically are the most important people to support a woman to breastfeed. Not even her best friend. It's usually her partner and her own mother. And if they are supportive of her breastfeeding, she's more likely to be successful in breastfeeding. So, I really agree with what you said. That is really, really important.
Next question is it supposed to hurt?
Oh, does breastfeeding hurt? Sometimes it hurts.
Sometimes it hurts. Sometimes it's actually, women have said that it's pretty shocking how intense the feeling is. Some women explained to me that they were surprised how strong their new baby is sucking on their breast, on their nipples. Yes. It is, and everyone says that. They say that it's amazing, it's intense. And sometimes if the latch is not correct or deep enough, then yes, it does become painful. And sometimes if the baby is not latched correctly, women do develop blisters on their nipples. Yeah. And that if the latch is continuously incorrect, that becomes a problem. So really, once you see difficulty and painful breastfeeding and blisters, then you definitely want to talk to a professional, see a lactation consultant, talk to your provider, so that latch can be evaluated.
Correct. Absolutely. And the best way to avoid sore or damaged nipples is to get the baby latched on correctly from the get-go. But that isn't always easy to do. And that's not because the nurses aren't good at it or the moms aren't good at it, but sometimes babies haven't read the same books, and sometimes the babies come out and if they pushed for a really long time, they're funky at the breast a little bit.
Right.
So we really work with moms to get a deep latch, and it's the deep latch that's asymmetrical, where the baby's chin is deep into the breast, that really helps to prevent. And I always tell new parents it's the same thing. You begin with nose to nipple. If you don't remember anything else, remember nose to nipple, because when this is the nipple, I'm the baby. If this is the breast like this and the nose is like this and it's pointing up like this, the baby goes, ah, and the nipple is pointed to the airy spot in the mouth so that the tongue and the gums won't pinch the nipple. And that's frequently how sore nipples begin, is a shallow latch coming straight on the breast as opposed to asymmetrically. So I often joke and say, I'm not a lactation consultant, I'm a lactation engineer, because sometimes it feels like for new parents, like they're docking the space station trying to get the baby onto the breast. And it feels that way, and it's almost impossible to replicate without a live baby because they're squirmy and they're moving, and it's really difficult to prepare for. But we do our best in our education classes to really give them the information that to prevent sore nipples, it's deep latch. So there you go. A hot tip for the day.
Right. And also just realizing that those first couple of days, those first 2 to 4 days, you're learning, baby is learning, and it will get better. Your milk will come in, and you will be breastfeeding while talking on the phone and cooking, and taking care of other things and answering email. That will come.
You will be surprised at how adept you become. Exactly.
I could share this story from last night. I was at a dance program at the Walt Disney Concert Hall, and there was a mom with a 2-week-old baby, and she was walking, and because the dance program was actually an outdoor site-specific dance program, and the mom was walking and breastfeeding.
Oh, beautiful!
Her 2-week-old baby, and she was enjoying the dance performance.
That's
so I was
beautiful.
like, okay, this is how it's supposed to be.
That's the way it's supposed to be, exactly. Do we have any more questions?
The next question is, if I don't enjoy breastfeeding, are other options equally healthy?
So it's hard to say because, it's actually not hard to say. Breastfeeding is what's best. It's what the baby needs. It's species specific. And so there's nothing, it's unparalleled. Human milk is unparalleled. Not every woman loves direct breastfeeding. So some women choose to pump milk for their babies, and that's a great option. Perhaps if they don't feel comfortable directly breastfeeding, another option is for them to pump breast milk, and many mothers are choosing that option. So we do a lot of counseling around breast pumps, and it is mandated under the Affordable Care Act that health care providers and health plans provide breast pumps to new moms who need it. Especially if moms are going back to work and they know that they're going back to work, a lot of moms really want us to work with them with making sure that their pumping technique is not harming their breasts and that they're getting the maximum amount of milk. So that would be the best choice if you don't want to breastfeed directly. After that, the artificial infant milks that are available are all appropriate ways to feed a baby. And one of the things that I really love to do is to work with bottle feeding families that have chosen to use the bottle, because there is a way to do it specifically that reduces and mitigates the risks associated with it. We know that formula that's not prepared appropriately can cause some really serious damage. And so we always teach our parents, this is part of being a baby-friendly designated hospital, is that we always teach our parents how to safely prepare formula and also how to appropriately feed it. And we use a technique called paced bottle feeding. It's a really important way because babies that are fed by bottle, whether it's breast milk or formula, are at greater risk for obesity and overweight. And that's because the way that they feed their babies, they often take in more than they would take if they were breastfeeding directly. That's one of the benefits of breastfeeding. So it's important for us to help all of our families to make the best infant feeding choices. And if their choice is to not breastfeed and they want to pump and bottle feed breast milk, then we absolutely support that decision. And if their choice is to formula feed, we support that decision as well. And we give them all of the appropriate information so that they can do it as safely as possible. All right. I think that is our last question of the day.
This was our last question.
Oh, excellent. So thank you so much for joining us today to hear about World Breastfeeding Week and how UCLA Health supports breastfeeding mothers. And we encourage you to reach out to our midwifery practice if you're pregnant now and are looking for a provider. And if you ever have any breastfeeding questions, please reach out to the birthplace at Santa Monica, UCLA. We're happy to answer any questions. Thank you.
Thank you.